What we're going to do is we're going to talk about, I'm going to show you exactly what to do for flexor tendon, right? So the question is, what's the best position to put a flexor tendon in when you are cleaning a wound?
Yes.
Okay. So we have a flexor tendon case, and it really doesn't matter what zone it's in, right? So I'm going to have you, let's pretend you've got this big old dressing, right? So we'll pretend here with this hand, because the one that we had was she had a right hand. She came in post-op dressing. So go ahead and you're going to put your elbow bent on the table and put your hand up like this, right? So she's in her splint. So this is the position of the splint, right? She's in her like post-op dressing, right? So you know almost to a T when you see a lot of people in this, you're like, oh, it's a flexor tendon, right? If you see someone in like this, you know, they're an extensor tendon. Let's say, for example, if it's a tendon injury, so you know that this is a flexor tendon. So you know that the incision's all along the palm, right? So if it's a zone, depending on the zone, you know it's going to be on this side of the hand. So if you're taking a dressing off, what's going to happen is the hard dressing is going to be on the dorsal side, right? So you then need to turn someone up here in order to get and cut the dressing off, right? To remove the dressing, correct? So I know you have the hard stuff on. You want to be careful because you know the incision is here along the fingers or along the palm. So you want to make sure that you're careful about where you're going to start your cutting, right? So normally they'll come in with an ace bandage, and then underneath the ace bandage is the plaster cast, and underneath the plaster cast is all the batting. Underneath all the batting is the gauze, right? And you shouldn't sit there and take everything off layer by layer. And just know that the batting is there to protect, the thickness of the batting is there to protect when they're doing the cast. So the batting is made out of this like cottony material, and it will stick to that. So when you go to remove that casting, knowing that it is stuck to that batting is really important, because you don't want to start pulling on that casting because it's stuck to the batting, right? When you remove the post-op dressing, it's very important to use a specific type of scissor. And these are the scissors you want to use. They're blunted in the front, and it's because you can slide in and you're not going to poke someone, right? Let's say, for example, you don't have this and you have small little scissors. I don't know whether my small little ones, but let's say you have something that's sharp like this. You have to be extra diligent and careful, because you don't want to come in cutting blindly and stabbing somebody. They will not trust you, and you will not gain that trust back. So let's say we know that the incision is over here. I like to then usually turn my patient's hand this way, and I'll start to cut. I'll start to cut, like I'll lift the bandage off, and I'll start to cut, right? You go from the thick bandage off first. Now sometimes the ace bandage you can unravel, right? Sometimes if people tape them down or whatever, then you can't unravel them. Once you unravel the ace bandage, then what you do is you have to cut through the batting, right? So if you can't come from this side, the radial side of the hand, the thumb side of the hand, it's extremely hard to put someone twisting their arm and going to the ulnar side of the hand, right, when you're cutting, if you're right-handed. So all you'd have to do is you want to use your finger, right, and then you'd have to lift off of the batting. Once you lift, using your finger to lift off the batting, then you can start to trim and cut, right? You got to cut through the whole layer of batting, the whole layers of gauze if you feel like it's wrapped up, and then one of the things I do is I'll clear it off, and then I can bring their hand up out of there. So then the dressing stays on the table, right? So then the thickness or the bulkiness of the dressing will stay on the table, and then you'll have whatever little stuff. You want to avoid yanking and pulling on people when you're removing it, because again, they just had surgery and you're just pushing and pulling too much. Now there's a fine line obviously of what you have to do if they're kind of stuck, versus like you don't realize that you're cutting something, like that you didn't cut enough, like you didn't cut all of the batting off, and then you're pushing and pulling on them and you're like still attached, and then you're trying to, you want to make that removal process as easy as possible for them, as smooth as possible for them. So usually I'll have a flexor tendon position like this. Remove their dressing, take it all off, right? Because they're still in a safe position, because that plaster cast is keeping them in a safe position. As soon as they come up, right, go ahead and relax. And then I'm just going to let you relax your fingers and relax your wrist. Right? There's nothing wrong with me. I don't know if you observed that, but when I brought you out, I put my fingers over your fingers, and then I brought you up and I said relax, right? And it's because I can stop you from opening all the way. If you were like, oh, people have this unconscious desire to move in a way that they want to move. So if they feel like their fingers are crunched down, they're going to automatically want to open it, right? And then you're prepared for it. And you're also, your hands here too, because if they want to squeeze, your hands right here for it too. And it's a way to be like, oh, oh, don't relax, don't open. Oh, no, don't close. Just relax your feet. Don't do anything at all. I'm just going to let your wrist fall down like that, right? And then you can say, okay, this is the best position to be in, because your tendons start from up here, go all the way down your elbow, and if you bring your fingers and wrist all the way back, you're gonna pull that tendon, right? And we don't want to do anything right now that's gonna pull that tendon. So if we put your wrist and down, it's going to relax your fingers, and it's gonna make your tendons stay nice and short, right? This is the best position to be in. Right? And then you can go from, and I always advise, okay, they don't know what's going on. You have to describe to them and give them a plan of everything you're gonna do. So, so today what we're gonna do is we're gonna remove all this extra bandage. It's going to feel really awesome once I get you out of that bandage. And we're gonna just take a look at what's going on inside your incision, and we'll clean your hand and incision if that's something we need to do, right? After we do all that, we're gonna make a splint, right? And the splint is going to be a nicer version of that cast that you have on, right? So what it's gonna do is it's going to just control your wrist so you don't go all the way back, and it's gonna help your fingers to stay in this position. So I'll start now, like as I'm explaining to them, like this is the splint's gonna help you to straighten up, make sure your fingers, your knuckles here are straight and you're bent here, and it's giving your tendons the best possible chance of recovering fully. All right, so this is something I'm gonna make for you. You can, wash your hands. I'm gonna show you the safest way to do that. Otherwise, you're gonna wear it all the time, right? So you can start to explain what you're gonna say and how you're gonna, but you're essentially starting out and telling them exactly what you want to do, but you're also getting a chance to feel, right? So this is the best position. Elbow on the table. I know that whether you have a 1 or a 2, you can still kind of handle them up here from the tips of their fingers, right? Because then you can hold them like this. So we have somebody, it's an index finger, and I'll hold all their fingers. I don't care which finger it is. Obviously, the one that is injured, you want to be nice and gentle with, right? But yeah, the stitches are going to be on the palm. So I'm holding up here, it shouldn't really affect it. And it's a nice hold. It's a very gentle hold. But with me holding at the fingertips, I can control your wrist and I can control your big knuckle and everything, right? And it's a nice, easy control. It's easy for me, it's easy for you. I'm not touching you yet, like in the incision, right? So that's the position that I would place them in, just to start explaining and talking. And this is the position I would say, like, oh, this is how I want to see. Like, this is where I'm going to start to feel. I always take them out, and I always want to feel how they're moving, because that gives me a gauge in terms of how they're going to respond to my cleaning, how they're going to respond to my range of motion exercises, and their and the home exercise program I have to teach them. I always start with the easiest finger first, and then I work my way to the hardest finger last. And I tell them the same thing. So this is the first time I'm going to be moving your fingers. Go ahead and relax. And what I'm going to do first, I'm just going to move your fingers that are not cut, right? And we just want to move those fingers. So I keep them. You see my index finger goes in between the index finger and the thumb like this. And my palm sits right on their palm. And it allows me to control their wrists. And it allows me to push away their finger, push away their thumb if their thumb wants to help their fingers. So this is a way of me giving any kind of tactile cueing and any kind of verbiage, like, oh, relax,
so
you know?
I did everything. But
okay.
I didn't, so my question is, I was trying to clean, so since it's in the palm,
yeah.
So how do you do that part of the wound?
Okay,
care?
yeah, I'm gonna get to it because I just wanted to kind of go the long route,
just perfect, to make sure I did that correctly. And so too, you know, when you test, I want to make sure how I did it, or what's the best way of doing it. Yeah.
So I'll go from the small finger, and I want to test for full extension. I need to see full extension, full flexion of them all, right? And then this time I can explain a little bit more the precautions, how it's going to be okay for us to move just like this. I'm going to show them how to do that. Then I'm going to test. Perfect, your hand looks really good. So now after I just check them, what I'm going to do is I'm going to clean them, right? I'm just going to clean the wounds. So
the first time you see them, like we're 1 week out, you can curl it up to the bum.
You can curl it, yeah. Day
Except
3, the stitches are there. No, you could push, but the thing is this is right now just right at the beginning. So I'm just going where I can because I'm just starting out with you. I'm not going to go from nothing to let me push them all the way down right now. So I'm just feeling for them, but I'm feeling the fingers that are not injured first so that they can feel comfortable with my touch, right? They can feel comfortable that I'm moving them. And they can feel comfortable that they feel okay. Like maybe it's not as painful, or they're gonna feel bad that's painful. So then I won't go crazy. If I feel her other fingers are loosey-goosey, I'm gonna think this one is gonna be okay. I can go a little bit further, right? But if the fingers that are not injured are already painful, that's already giving me a mindset of like the finger that actually got hurt and had surgery is gonna most likely be even more painful. So I'm gonna go nice and gentle, and I might ask like, oh, let me just tell me when. Just tell me when you can't take anymore. I just want to feel for right now where it's at, right? And then that's it. And then and a lot of times when I'm speaking to them, I'm feeling with my hands, but I'm looking at them because I want to see their reaction. I want them to look at me back versus like fixating on their terrible wound that they're seeing for the first time, right? So now I'm gonna clean your hand, right? So I'm gonna turn, and I'm gonna have you have your palm up like this, and this is how I clean it.
So you constantly have to hold, because that way they're not contracting.
Yeah.
So you have to hold it.
So I don't really have to hold it at all. Like my hand is here. So before I clean, I'm gonna get all of my stuff ready, right? So okay, so go ahead and just relax your hands there, right? I'm gonna make sure that if I have a wound care, that's gonna be a wound care. I should have all my stuff ready because I know what I need to do, and it shouldn't be on the table. It should be on the towel, right? So if you have gauze, you should put the gauze on the towel. It should not be the gauze on the table, the conform on the table, everything, the bottle. So we're not in a sterile field, like we're not sterile, but this is cleaner, right? Or the perception is that this is your space. I just brought this towel out for you. Nobody else has touched this towel but you, right? So there's also a perception of how clean this towel is. So when I get my gauze ready and I get my conform ready or whatever, I'm gonna put that on the towel. The normal saline, I can leave that on the table. It doesn't really matter, right? But usually when I do the post-op dressing, I will then.
So here I see, I'm like, my wrist is extended.
Okay, but your fingers are flexed. So this is a still protected position.
And you're not forcing them closed.
They're just a natural position.
That's why I was
right? Yeah. So it's just a natural position of being rested. And then what I'm going to do is I can go into extension here because I can go into extension here because my MPs are flexed. Okay. Right? If my MPs are flexed, I can do that, right? So I'm going to, so if I want to, I'll just turn her hand to the side. But I'll have like this, right? I'll keep it like this, and I'll have my gauze. I'll get my gauze. I'll put the towel here. So if someone just like sits there naturally, if their fingers are just natural like this, I just leave it.
Yeah, it's just
okay.
hard to get into this area without extending.
Yeah. Well, yeah, you just have to keep your thumb behind the PIP, right? And then I just clean it like this, right?
So
if I want, yeah, because your MP is bent, but your IPs are straight. So I can make your IP straight, and I can just clean, right? I'll clean your palm, I'll clean your hand, right? I'm gonna clean your palm and your incision or whatever right here first. Now, if I want to get in between your fingers, relax your fingers. I'm going to put you up like this, and then relax your wrist down. And look, because you open your fingers, and now I can clean in between your fingers much better. Yeah. And I'm not struggling. Yeah. Mm-hmm. You're not struggling, I'm not struggling. And that's how you get in between the fingers. Yeah. But you do the palm first, and then you get in between the fingers second. Yeah. Right? So that's pretty much right after post-op removal and wound cleaning and positioning for wound cleaning. Right?
Testing.
All right, so testing.
I feel like you can't really see my hands and that, like you would see the back.
That's okay, but it's the position of my hand.
Okay.
Right, so it's a position of my hand that you're seeing. So, all right, so when it comes to testing, so I always like to test my flexor tendons to make sure that when I see them, like if it's the first time I'm seeing somebody, I like to test that it's intact, right? So you might not be able to see it from this side, so we can use your other hand from this side, but it's pretty much the same thing. If you follow the guidelines of a flexor tendon injury, is that flexion of the wrist is the safest, and when you do wrist flexion, your fingers naturally extend. It's the tenodesis of the hand, right? So your wrist goes down. Everyone should try this. Have you done this before? Yeah. So just relax your wrist and your fingers automatically open. And then when your wrist goes into extension, your fingers automatically close, even without doing anything to the fingers. That's wrist tenodesis. That's synergistic wrist motion. They got fancy names for everything, okay? But it's the same shit. So that is a safe position. So if I want to test for a tendon, I'm not testing that flexor tendon in the most extended position. I want to put that tendon in a flex position, and I'll put the MPs a little bit in flex, and I'll hold the PIP, and I'll just say, like, just move your little knuckle just a little bit. Just a little, yep, that's it, right? Like, it's literally a small arc of motion. So if I put my finger right here, bend the tip, there, right? I can put it even less, bend the tip, and then all I'm looking for is a little wiggle, and all I'm feeling for is a tendon glide. So if you did it to your own finger, Oscar, if you put your finger right here underneath the DIP and you did blocking, right, you would feel that profundus moving. Yeah. Right? And then in order to feel the superficialis, you'd block and then ask to bend the
I did it with
PIP.
The MPs bent. I didn't do it with the wrist bent.
That's okay. It's the same thing.
But so ideally, so I was actually thinking that you were going to suggest to do it with the hand straight and then squeeze, and then squeeze.
No.
Oh, okay. So it's actually better to do it.
Yeah, because they're because because here they were straight. So you are putting the tendon in a stretched position, not in the utmost stretched position, but you had them in a stretched position. So you've got to think, what is safe right now? The safe right now is to put the tendon in complete slack. Now, so if you didn't do the wrist, then you would, So this is also synergistic wrist motion, right? So your wrist was in extension and your fingers were in flexion. So that allowed the flexors to be loose. Okay. So that position is safe as well. So this position is one part of the synergistic wrist motion. The other part, this is also synergistic wrist motion. So in whichever synergistic wrist motion you do it in, it's fine because both positions put the tendons in slack. Does that make sense? So the wrists here, the MPs are extended, but you can flex them just a little bit, and you're just doing a blocking, and you're not asking them for a full pull. You should tell them, I just want to feel that you're doing a little bit. And if they haven't injured all their fingers, I will test the uninjured finger first.
You do?
Yes.
Why?
Because I want them to know what it feels like to pull a little bit. Right? So if this is her finger, I'm gonna tell her, I want you to pull with this one. Let me feel that one. Right? Perfect. If this pulls and this moves, I've already tested that it's intact. Why?
Because it's one muscle belly.
It's because it's the profundus and it's one muscle belly and it's it's pulling, and that's why you're going to see them both move. Right? So that's fine.
It's still not be intact, right?
No, if it's pulling, it's probably
if it
moving.
Moves.
Yeah, if this moves. Yeah, if I ask you to block here, just pull just a little bit, and then this wiggles.
Oh, because she's doing it together.
Yeah, because she's doing it together. She can't isolate the DIPs. She can't isolate the profundus. So then it's intact. Now that's not necessarily the same at the PIP. So you're gonna say, oh, I just want you to pull just a little bit, right? Perfect. That's all. I just want to feel how that moves. So I'm gonna test this one. So pull just a little bit. Boom. That's it. And I tell them that. Don't do that at home. It's just like those videos that you say you have to disclaimer. Now, children, don't try this at home. But you pretty much have to be like, I don't want you doing that at home. That is just me checking to make sure everything is intact and everything feels really good. So that's the way we want to keep it, right? So then you can go into your precautions, and then you can tell them what they're allowed to do and what they're not allowed to do, right?